Orthotics are a device that gets put into all footwear to hold the foot in its most optimal functioning position. So if we look at a foot, a normal foot would be in what we call a neutral position. If for whatever reason, if genetic predispositions or an injury has caused the foot to either roll in or roll out, the foot becomes strained in certain areas, and that's often when an injury or a pain will arise. As a podiatrist at DiamondValley Foot Ankle Clinic, the patient comes in, we assess the patient's foot sitting non-weight bearing, and then we'll get them walking and having a look at how their foot and leg is functioning. If for whatever reason that is the case, that the foot's rolling in or rolling out, or certain areas and joints are not working optimally, then we take a plaster cast of the foot, which we then fill with plaster and have an exact replica of the foot. We then hold that foot in the right position and mould an orthotic to hold the foot in that position. Orthotics can come in a range of materials, either a hard plastic orthotic, which has this arch support you can see here to hold the foot in its most optimal position. We can also go for a softer material for people that cannot tolerate the harder material, and it's made out of like a soft foam rubber, similar to that of the inner sole of your runner. As you can see, we can do a shorter length one. It's more suitable for women's shoes that may have trouble fitting a larger orthotic, or we can do the full length device, ideal for men's work boots or for runners, any shoe that can fit a longer orthotic. The extra length just gives some extra padding underneath the toes. The main function comes from the orthotic still, not the actual top cover, but we offer all ranges of orthotics at DiamondValley. Depends on the need and what's going on with the foot really. We reassess our orthotics 12 monthly to make sure that they're still supporting the foot. Generally in children, they're more likely to gain strength in their foot and grow out of it than what an adult is. But in saying that, some children will need to be followed through, and we'll just change the orthotic as they grow and make sure that the foot's held in the right position. In conjunction with orthotic therapy, we do offer a number of other treatments, including exercises and activities, balance training to re-stabilise the foot, and that all works to support the foot and make the results better, along with wearing an orthotic. If we go down the line of not wearing an orthotic, some patients will try other options, and that's fine. We just need to keep in mind that the foot being at the bottom of the leg is a main stabiliser of the rest of the body, so you can get strain and pain and injuries in other joints further up, including the knees and hips and lower back. And if that's the case, then we really need to be looking at getting your foot into the right position. If you have any concerns of your foot or ankle, or you're getting pains in your knees and hips, it's worth getting an assessment just to check your alignment and make sure your foot's functioning in its optimal ability.